in as well. You run your tubing through an IV pump and set it according to the rate and the dosage that's prescribed for the patient. After, now that you have an IV infusion and IV access, if you ever need to change your IV solution or your tubing, you would disconnect it from the patient's IV access, clean the IV access, and recap it. You would discard of everything that you previously had, rehang your new medication or a secondary or third bag of the new medication that you needed. To do this is the same thing. You would just reinsert the end and fill your drip chamber, get all the air out of your tubing. If you need to change your dressing on the patient's IV access, you would want to remove the old dressing. You would want to find a starting point, and you always want to pull the patient's skin away from the dressing versus trying to just pull the dressing off. You don't want to cause any kind of damage to the skin integrity. When you have an IV access site or an IV infusion going, it's very important to always monitor your patient's IV access. You always want to check, make sure that there's no redness, inflammation, no kind of infiltration, hematomas, anything. If there's anything of that sort that occurs at any time, you want to immediately discontinue your bolus or your IV infusion and remove your IV access and obtain a new IV access site. If you need to just flush an IV access site to check and make sure that it's still patent, you would want to go in, uncap it, wipe it off, get a saline flush, attach it. You want to aspirate, look for blood return in your tubing, flush the IV, dispose of your flush, clean it, recap it. If you want to give IV medication through an infusion and you have your tubing, it works the same way as a hep lock. You want to stop your infusion. You want to clean whatever port on the tubing that you want to access. There's several on here. Clean it, same thing. Make sure you have the correct medication. Compare it to your MAR. Check your 5 rights of medication. And you would attach a syringe the same way at one of your IV access ports. And flush your medication. And resume your infusion. If you ever have to infuse a blood to your patient, it's similar with a few added notes as medications. You want to check your order. You need to verify it with 2 other nurses. You always need to check and make sure that you have the correct blood type and that it's the correct blood ordered for the patient. You want to always check the blood, make sure it's the correct type of blood, make sure there's no clotting or any issues with the blood that you're going to administer. You would insert your drop set the same way. Get, all the air out of your tubing. And once you started your infusion on your patient, you want to sit with your patient for at least the first 5 to 15 minutes, and you want to start your infusion slowly, typically about 2 milliliters an hour. This allows for you to assess for any sort of adverse reactions that the patient may have to the blood transfusion. After the first 15 minutes, you can continue. You still want to monitor, but you don't have to sit with your patient. Other than IV access devices or IV site access and blood infusions and fluid infusions, medication infusions, you may have to access a central venous line. I don't have one of those to show as a demonstration. They typically have like 3 lumens, so 3 different ports. So you may have to check and flush and assess all 3 ports. You always want to go in, and same thing, you want to uncap them, you want to clean them, you want to hook a syringe to the end of the port. And the difference with central lines is you want to aspirate 10 cc's out of the access site, and because there may be heparin in there and you don't want to put that in your patient. And you want to assess for blood. You don't want to pull blood all the way back into your saline flush, but to your tubing. And then you can give the medication that you need to give. With central lines and any other IV access as well, you also want to make sure that if there's any kind of resistance that you're meeting, you don't want to force that. It could be a blood clot, and you don't want to send that into your patient's bloodstream to cause adverse reactions. So once you've gave your medication through your central line, you want to check your facility's policy of what type of what they use to flush the line with. They may use heparin, they may use something else. You want to administer this over a slow period of time, 1 minute. Typically, you just want to, like, every 10 seconds, 1 cc, just kind of push it in a little at a time. You don't want to just put it all in at once. And once you've put that back in there, you want to clean your port and recap it. And when it comes to accessing an implanted port, I don't have one of those either. I'll just use this as an example. Anytime you access a patient's medical port, also with a central line as well, you want to wear a mask. And you always want to have your patient turn their head the opposite direction away from it, because it needs to be kept sterile. So anytime that you are accessing a central line or a patient's implanted medical port, you want to have a set up sterile field. Once you have your sterile field set up, you want to identify your patient's med port. And after you've identified the anatomy of where the port's located, you want to clean it. Once you've cleaned it with alcohol or whatever the facility policy states, you do not want to retouch this. And you don't want to touch anything else in your sterile field. So with your non-dominant hand, you would want to hold. Once you have a hold around the patient's medical port, you cannot turn loose of it. Don't touch it anywhere else. This hand's pretty much stuck there. And you would want to, there's special design types of catheters for medical ports. You would want to insert your needle at a 90-degree angle. And once you have access, you'll have tubing on the end. You want to aspirate. You don't want to pull blood all the way back into your flush. Once you've aspirated, flush. Make sure you don't have any kind of resistance. Everything's flowing. Make sure there's no sort of irritation or anything. If you need to, you can change the dressing the same way on these as you do IV accesses. You want to remove the old and clean it and replace the new. Deaccessing a medical port is pretty much the same. Once you have accessed it and you gave your medication,